Hello, my name is Dr. Karen Donahue. I'm a physical therapist and owner of OrthoSports Physical Therapy in Phoenix, Arizona. Today we're going to talk about the diagnosis and treatment of plantar fasciitis, commonly referred to as heel pain. If after this presentation you are interested in obtaining an evaluation for your heel pain, we have two locations. One located in Glendale at 43rd Avenue and Bell Road, one located in the Maryvale region at 53rd Avenue and Indian School. The contact information is available on this slide and at the end of the presentation. The etiology of plantar fasciitis is that it is the most common source of heel pain. This condition accounts for 10 to 22% of all runner-related injuries and 15% of all foot symptoms requiring medical attention. 83% of the patients are active working adults between the ages of 25 and 65 years old. The symptoms of plantar fasciitis include a progressive pain at the heel, usually on the bottom of the foot region. This pain is sharp and worse with the first steps following rest or upon waking in the morning, prolonged standing, or prolonged sitting. The pain often decreases but does not go away with walking or beginning of activities, but then steadily increases throughout the day or increases as the activities increase. This pain can also be produced by touching the heel on the bottom of the foot or stretching the foot back towards you to stretch the bottom of the foot. What is the plantar fascia? The plantar fascia is a very tough ligament-like structure that attaches at the heel and attaches at the base of the toes. And what it does is to provide support to the foot for walking and adjustment on different surfaces. The plantar fascia provides the primary truss support for the longitudinal arch, or the arch in your foot. It attaches to the base of the toes and attaches to all 5 toes, and it has one single attachment onto the heel. What it does is it produces what we call a windlass effect. So if you look at the diagram, the line is the plantar fascia. It goes from the base of the heel. This would be the back and the ankle and the leg. These would be the toes. So what it does is it produces a structure or a rubber band or tension between the toes and the heel and allows the foot to maintain an arch in the foot. There are many muscles on top of the plantar fascia in the foot. The plantar fascia is not the only structure in the foot. In fact, there is a lot of muscle in the bottom of the foot that also contributes to the stability of the foot. Primarily, these muscles are involved in toe flexion, or bending your toes, which is used when you push off when you walk. The calf muscles also significantly contribute to the function of walking or propulsion, and many of these muscles also go into the same region of the plantar fascia on the bottom of the foot. The primary muscle is the posterior tibialis, but also is the flexor digitorum longus and the flexor hallucis longus. Both of those bend the toes or assist and bend the toes, but the source of those muscles are up in the calf, not in the foot. We also have a series of muscles in the front of the lower leg, particularly the tibialis anterior, which is this muscle that runs right here. This muscle is responsible for being able to pull your foot up towards your shin. But we have other muscles as well that attach to the toes, which are called the extensors for the big toe and for the little toes as well. So what causes plantar fasciitis? It really is a fatigue or weakness in the dynamic arch supporters that diminishes the ability of the body to accept the load of the ground, or what we call ground reaction forces, effectively. And thus the support, or the truss support, of the longitudinal of the arch, which then produces a stress on the passive structures, especially the plantar fascia. So there are a lot of muscles in the foot and in the lower leg that are controlling your motion when you walk. The plantar fascia is not a muscle. It has no activity other than to hold the toes and the heels together. If the muscles are not working well, then the strain occurs at the plantar fascia region. What are the common evaluation findings that we have? Well, what we know for sure, and research has confirmed, is that the plantar fascia is not inflamed, meaning there is no swelling, there's no tissue inflamed. It's not a contractile tissue or a muscle, so it doesn't have any swelling to it. So the taking of ibuprofen or any anti-inflammatories is probably not effective or super effective, because we know that the tissue isn't in an inflammatory state. Okay. But when fatigued, the muscles such as the posterior tibialis, the muscle in the back of the calf that support the longitudinal arch, fatigue, and now they can no longer support the foot. So when you're walking, the stress goes right into the plantar fascia, which pulls onto the back of the heel region. Here's a picture of a person running a 26-mile marathon. You can clearly see that her foot is landing very flat. And what we find with runners who fatigue is that they lose their push-off and they tend to run more flat-footed. When this happens, the toe flexors and the foot intrinsic muscles are fatigued and weak. And so the plantar fascia then is taking the stress of the body weight when you run, instead of the muscles being able to absorb some of that force as they normally would do. It's a function of fatigue. So what are the clinical findings that we'd find in the clinic? Well, what we would find when we perform an evaluation is that we would find that the toe flexor muscles, the muscles that curl your toes, would demonstrate weakness. We would find that the toes would tend to rest up a little bit because the muscles on the other side of the foot, the extensor digitorum brevis, is actually short and holding those muscles up, and it looks like your toes are resting up just a little bit. There's excessive range of motion of the big toe, of the great toe, greater than 60 degrees, and you cannot pull your ankle back as far as normally should be. And what we definitely find is that there's no weakness in the lower leg muscles, particularly the tibialis posterior. So what is created when we run or fatigue or get plantar fasciitis? What it is a muscle imbalance of the foot and the lower leg that is producing mechanical changes, not chemical changes, meaning it's a stress on the heel. It's like super gluing a rope to the edge of the heel and tugging on it all the time. Okay? The muscle imbalances in the lower foot is produced by the weaknesses that we talk about. The toes that curl are not as strong as the muscles that pull up. The muscles that should be in the bottom of the foot and supporting it are not supporting it very well, and the muscles in the back of the calf are working too hard. What happens is we get an insufficient truss support due to this weakness and increased loading, which strains the plantar fascia. The plantar fascia then is placed at end ranges due to excessive toe extension, putting the plantar fascia with more load at the end, particularly in push-off. Many times this tug on the heel by the plantar fascia produces a spur, and many times on x-ray for people who have plantar fascia, they will be informed that there is a heel spur. The heel spur is just an indication that this mechanical pull from the plantar fascia has been going on for a very long time. So long, in fact, that the bone has changed its shape to accommodate to this pull of this fascia on the bone. We believe that it's this mechanical strain or pull on the bone by the plantar fascia that is the source of the symptoms for plantar fasciitis. So if we go back to the windlass effect, what happens here in the fatigue condition is that the way you walk changes. And what happens is that instead of hitting your heel and pushing off your toe when you walk, you tend to hit more flat-footed and you tend not to push off. This is what happens when you fatigue. When that happens, the muscles in the feet do not work very well. As a matter of fact, they don't work very much at all. And to compensate for that, the muscle in the back of the calf, the posterior tibialis muscle, it starts to do all of the work. The foot and the lower leg were not designed that way, so the posterior tibialis, that muscle in the back of the calf, gets stronger and stronger and stronger. The foot muscles get weaker, 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 and now we have an imbalance where the foot muscles no longer can contain the strain on the plantar fascia, and the pulling on the heel starts to occur. So the presence of toe flexion weakness, coupled with your inability to pull your foot back, produces a passing rolling over of the first metatarsal, or your big toe. So in the picture right here, here's a person that we found walking. And what you see is that as she walks forward, or as she's pushing off, you can see that her toes bend way up, farther than they should, and that there's very, very little push off. Here's a picture of the person resting. You can see that because she cannot pull her ankle back all the way, that's as far as she can go. You can see that the toes try to do the work and pull back too far. This angle right here is too much. And when that angle comes back and pulls this way, all of the tension through the plantar fascia gets very taut and produces that tug on the heel. The passive rolling increases the shortness of the toe extensors, and the toe extensors are the ones that pull your toes up when you walk. The toe flexors are the ones that push your foot down. The lack of dorsiflexion, or the lack of the ability to pull your foot back up here, means that this muscle up in the front, the anterior tib, is weak, because the muscle in the back that's doing all of the work, the posterior tibialis, is too short and too strong. As a result of not being able to pull your foot all the way back so that you don't trip, your toes take over, and your toes get right out of the way, or they do what we call wink. They pull way up out of the way so that you can clear them without touching your toes. So these muscles are working really hard. This muscle's working really hard. The ankle can't come up as far as it should. And that's what starts to produce the symptoms of the plantar fascia. So the treatment is to return the muscle balance to the lower leg and to the foot. We need to increase the strength of those structures that are weak, the muscles that curl your toes, the muscles that support the foot, and the muscles that pull the ankle upward. We need to stop strengthening the muscles that are too strong, which is the posterior tibialis on the back side, and the muscles on the front causing your toes to wink or clear as you go. This requires a lot of practice and professional intervention for you to learn appropriate mechanics in order to change the muscle imbalance and structure of the foot. It is only by changing the structure and the muscle strength and balance of the foot that the plantar fascia will relieve its stress and that the symptoms will go away. Using night splints at night to help pull your ankle forward does not solve the problem, because it does not change the strength of the weakness of the muscles in the toes and in the bottom of the foot. Hence why night splints repeatedly in research have shown minimal effect or success in relieving plantar fascia pain. The treatment is twofold. One, again, we have to provide very specific exercises in order to decrease these muscles imbalances. So if you look at this picture here, you can clearly see that the toe is going up too far. We need to be able to strengthen the muscles right through here to bring the toe more into this type of position, and we need the ankle to be able to come back further. So it's a series of stretching and strengthening, but primarily strengthening those structures which are too weak. That takes a little time. So in order to relieve the stress or the pain of the heel, one of the most effective techniques that we have is to use some tape, which we call Leuco tape, which is a very tough, non-stretching tape. And what we do is we want to put the foot into the position that we think is most appropriate and that will decrease the stress or the pulling of that plantar fascia on the heel. The way to do that, of course, is to limit this motion right here. So the taping technique is going to put the foot in this position here and hold it there. By holding it there and not allowing the plantar fascia to get stretched, the symptoms, the pull on the heel stops and the symptoms significantly diminish. This is what the taping process looks like at the end. It's designed to hold the toes more into a bend and prevent, as you can see in the second picture here, prevent that big toe from pulling back forward. So the tape, by doing that, we decrease the amount of pull that is happening at the heel region. We've had incredible success with performing the taping procedure and improving and correcting the movement impairments and muscle imbalances in the foot, where we have been able to abolish or reduce the pain for plantar fasciitis in 90% of our patients within 10 weeks. The problem with this is that we're dealing with a bunch of small muscles and we're dealing with some very powerful big muscles. And so the treatment takes a little longer than it would be if it was a muscle injury. It takes about 8 to 10 weeks to correct the muscle imbalance and movement impairments in the foot and ankle. And the taping procedure remains in place for up to 4 weeks to ensure that the strain or the pull of the plantar fascia on the heel is kept to a minimum. If you would like an appointment or to have an evaluation or just to discuss the treatment plan further, I encourage you to contact us at our location. Our phone numbers for both the Phoenix and Glendale location is located on the slide, or you can contact me directly on my email at azospt@aol.com. Thank you and have a good day.